Keck Medicine of USC is at the forefront of innovation in colorectal surgery.
The way we treat patients with colon and rectal disease is really going through significant changes. We used to open up patients' abdomen and cut out part of the colon and put it back together. And over the years, we have been able to do this laparoscopically, meaning using a small camera and then limiting the incision that we had to make to remove somebody's colon. But now we're on the verge of figuring out a way to treat patients' problems without having to remove any part of the colon. And this is called endoluminal surgery. And it's one of the techniques and technologies that we pioneered here at USC.
But this advanced care is only available in some parts of the country.
So for example, if somebody presents with a very complex polyp or very large polyp that gastroenterologists don't feel that they can remove using colonoscopic technique, in this country 50% of the patients will probably have to have open colon surgery. And if you're lucky, 50% that live in large metropolitan areas where the technique is available, you can have laparoscopic colon surgery. But even with the laparoscopic colon surgery, patients stay in the hospital for 5 days, and it takes them 3 or 4 weeks actually after the surgery to return to work. With endoluminal surgery, it's often possible to discharge patients on the same day, and they go back to work within days as opposed to weeks.
Dr. Lee is working to bring these life-changing endoluminal techniques to the nation.
Over the last 4 years, I've set up a course here that we offer twice a year, and we invite all of the colorectal surgery fellows that are training to be colorectal surgeons, and they come to USC and spend 2 days with us learning about new technologies and new techniques. And we also invite and have a sponsorship from industry with the new platforms and new techniques and new technology to bring their latest and greatest equipment so that these fellows will train and learn how to do these procedures when they go back.
Surgical fellows need support to undertake this vital training.
You need to support these fellows to come here, take some time off their training to spend actually a day or two to travel and spend time with us, obviously, and it takes money and grant and financial support to be able to accomplish this. But I think it's well worth it, because the fellows will take what they learned here, and once they finish their training, they'll start to think about different ways and new ways to treat the patients in a much less invasive way than we're treating patients now.
And private support is crucial.
We absolutely need private support to be able to continue doing this, because every year support from industry is becoming less and less, and it's becoming also very, very difficult to raise any grants to support a program like this.
Your support will help more people get access to safer, less invasive colorectal procedures.
Essentially, we're going to change the inpatient care of colorectal disease to outpatient care.